Alright, wrist, hand, and pelvis time. I think most people would agree that these are the toughest places on the body to memorize, and most of it is because of this area that you're looking at right now. This is the left hand in anatomical position. I will zoom out so you can see what I'm talking about. And what we're going to do is come up with a little mnemonic device for remembering the carpals, the bones of the wrist. Those are probably the toughest ones, probably even more difficult than the bones of the ankle, so the bones of the foot. So we're going to go from lateral to medial bones. We're going to start with the proximal 4 and finish with the distal 4, going both lateral to medial for both proximal and distal bones. And they are scaphoid, lunate, triquetrum, and pisiform right here. Scaphoid, lunate, triquetrum is underneath here, and pisiform is this little guy on the top. And then continuing with the same format, going lateral to medial on the distal carpals. We have trapezium, trapezoid, capitate, and hamate. And if you've ever seen the show Scrubs, they do a silly mnemonic device for that, using the same order of the bones, and that is some lovers try positions that they can't handle. And that might be a little bit racy for some people, but the sillier or the goofier the better. If you want, you can actually search it on YouTube. Just type in Scrubs carpal bones, and I'll show you a quick clip from the show. Alright, so those are the wrist bones, which are often difficult to memorize because really their size and shapes are kind of random and difficult to identify. So you just have to pick a direction and go with it. You can start with a thumb and go around in a circle counterclockwise, or you can go clockwise. It just kind of depends. So again, we started with the proximal and went lateral to medial, proximal 4 bones, and then the distal 4 bones, same way, lateral to medial. Alright, so that wraps up the wrist bones. Now, the hand bones, which are pretty easy, they're just called the metacarpals, and they are identified 1, 2, 3, 4, and 5, and we always start with the thumb as number 1. So this would be the first metacarpal, second, third, fourth, fifth metacarpal. Pretty easy, I think, for those. Then we move on to the phalanges, and these are also pretty easy. The first phalanges of each finger are called the proximal phalanges. So again, this would be the first, second, third, fourth, fifth proximal phalange for each. The thumb does not have the next set, which is the middle phalanges. The thumb is missing that bone and goes straight to the distal phalange. So again, this would be first, second, third, fourth, fifth, distal phalange. Alright, we're going to move over to the pelvis, which is right here. We have some sections of the pelvis that we need to identify. They are too far zoomed in. We have the ilium, which is this top part right here, and goes about halfway through where the femur comes in. You can see that there. I'm going to actually take out the femur so you can see that little cup-shaped structure. That's called the acetabulum. And so if you can assume, looking at it in anatomical position, about halfway up, right here, about halfway up is the ilium. Okay, and then going down the outside, about halfway down, halfway through the acetabulum and down to about this imaginary line right here is the ischium. Okay, so right out here is the ischium. Let me take off the yellow because it might not be helping very much. Okay, so if you can draw an imaginary line through this acetabulum, which is the fossa, it's a facet that's going to hold on to the femur. It's going to accept the femur, head of the femur. About halfway through that, up is the ilium. Halfway through it, down is the ischium. However, the ischium is just the lateral portion of the lower part. The inner portion of the lower part is the pubic bone. That would be right here. And then in between the pubic bones, these are two halves of the pelvis. In between the pubic bones is the symphysis pubis, which is just a little piece of cartilage. It forms a joint here. There's not a whole lot of movement here, but there is some movement. It's significant in during childbirth. And then the last thing we have here is called the Obturator Foramen. Right here, this hole that goes straight through the bottom of the pelvis. And that's doing quite a few things, supplying nerves and blood and muscle are passing through there for the bottom half, down here, femur and others. Alright, so those are the bones of the wrist, the carpals, the hand, which are the metacarpals, the fingers, which are the phalanges, and then all the different parts of the pelvis that you need to know. Ilium, ischium, pubic bone, the acetabulum is what's going to accept the head of the femur right there. Symphysis pubis is the cartilage joint right here between the two bottom halves of the pelvis. Also on the inside is the pelvic brim, which is basically the imaginary line that makes up the the birth canal. So that's sort of the anterior region of the sacrum, and then this lining of the ilium and pubic bones that makes up the pelvic brim, or the birth canal. And that should pretty much wrap up the wrist, hand, and pelvis.